Hi friends, I am Dr. Rushabh Shah. I am an eye surgeon and I specialize into squints and pediatric ophthalmology. So today we will talk about a condition called as amblyopia or lazy eye. Now amblyopia is a very common condition that we encounter in our day-to-day clinical practice. Often just when a child comes for a routine examination brought by his parents, we detect that the child is having a reduced vision in one of the eyes, which cannot be attributed to any other cause, and we define this as amblyopia. So that's why the importance of screening and routinely treating such children, because the child himself is not aware of this condition and neither is the parent aware of it, because the child doesn't complain and the child looks normal to the father or the mother. Definition of amblyopia means it's a condition in which there is a reduction in the best corrected visual acuity in one of the eyes, and it cannot be attributed to any structural abnormality. It is often seen in childhood, and it is because of an interruption of the visual cortical pathway which leads to a abnormal visual development. Often we define it as a loss of parity of two lines of best corrected visual acuity between the two eyes. So causes of amblyopia, it can be an uncorrected refractive error which has hindered the vision potential to go up to its full potential. Sometimes there can be a squint which has caused an amblyopia in the eye, or sometimes factors which obscure the visual axis and cause a blurry vision, like conditions like a corneal disorder or a macular pathology in the retina, or a cataract which can cause an amblyopia in a child. Symptoms: it is often the child is not aware that he is suffering from this condition. When we accidentally picked up, when we check the child, or when he is referred from the school, or we do a school screening, that we come to know that the vision is less in one of the eyes. Sometimes, however, the patient becomes aware when he closes his eyes accidentally and he notices that the vision is less. So first and foremost, once we diagnose as a child to have amblyopia, the first and foremost thing is to correct the visual acuity and give the best correction to the child, so as to first let the vision improve. If in spite of glasses the child is not improving, the vision is not improving, then we have other modalities wherein we do an occlusion therapy or a patching, where we close the sound eye so as to stimulate the weaker eye to see better. So what we call as a patching or occlusion therapy. Once the patch is started, depending upon the severity of amblyopia, we may need to titrate the dosage. Some children may need 1 hour, up to 2 hours, up to 6 hours a day if amblyopia is very severe. And the child has to be routinely followed up every 2 to 3 months to see the improvement in the visual acuity. Often the treatment can go on for 4 to 6 months or even a year or two. It is important to stress upon the parents that even a single day should not be missed when the patch is not done, because then the effects which have been gained can be easily lost if the child is not compliant to the treatment. In certain children, they are very fidgety and mischievous and they are non-compliant to patching. So then if patching, though it's still the gold standard, if it is not working, then we do something called as penalization, where we use certain eye drops like the atropine eye drop 1%, which is instilled into the good eye so as to blur it and to make the weaker eye see more. So penalization is done in certain children who either don't allow to patch, or who are not routinely, regularly, or forgetting to do the patching. Sometimes we have other newer modalities of treatment called as diagnostic therapy or vision therapy, wherein with the help of the computer aided softwares, we make the child to play games on the computer, where he has to pay attention and play different games, and different tasks are given. Special anaglyph glasses are given, red and blue, to dissociate the two eyes and to make each eye see separately. And the contrast also is adjusted so as to make the amblyopic eye see more and keep the contrast in the good eye lesser. And these sessions have to be done for a period of 20-30 minutes every day for a period of 2 months, 3 months, 4 months, depending on the visual needs of the child, and the child is regularly assessed. Diagnostic therapy or vision therapy is also showing good results. It is slightly different in a way that it stimulates both the eyes to work together as compared to patching, which is uniocular. Diagnostic therapy is a binocular therapy. So in cases of ametric amblyopia or amblyopia in both eyes, or in certain refractory cases, or even sometimes in adults, this diagnostic therapy is showing good results. Amblyopia has a socio-economic impact on the child's life. It is quite prevalent in the general population, and most of the children who are very young are not aware. So that's why stressing the importance of regular screening, going for eye checkups regularly, and getting the treatment in the form of glasses or patching or lenses is very important. Often it is seen that if we miss this condition, the vision does not improve and remains where it is. It remains reduced for the life of the child, and because of which the child has significant economic impacts as well, and quality of life suffers if this condition is left untreated. So I hope you like this video, and please press the subscribe button for more such informative videos and to help us to do better. And please share it with your friends and colleagues so that more and more people come to know of this condition.